address? As they have missed that, I think.
No.
No?
I can't say
Councillor Williams, are you happy?
Yeah, I don't believe I've got anything relevant to today.
Fine, thank you. The meeting will follow the usual format then, starting with an update on the local outbreak and evacuation plan from Paul Masters, our Chief Executive. Please, Paul.
Thank you, Chairman. Good afternoon, colleagues now, as it's 1 minute past 12. Well, quick update from me, because I'm sure the main issue will be all about the new variant and news from Rachel. But from a council point of view, things have begun to ramp up a little bit from a sort of council point of view, with many ministerial calls being organised and many letters that seem to be popping into our letterbox at the moment, asking us to, in effect, get ready to continue to operate support to the vulnerable, to back up all messages about vaccination, to urge people to, continue to have good public health measures in place about hand washing, mask wearing, etc., all the things that we're used to on the island. So we're just repeating and relaunching some of those comms. Some of the issues that are of a national significance aren't so much on Scilly, such as sort of rough sleeper campaigns, etc., in terms of vaccination programmes. So some of them aren't quite as appropriate to us, whereas, of course, some of the others are unique to us, such as the evacuation scheme, which we still have in place. I think, just for the record, I think over the last 12 months, we've used the scheme 8 times in total. And, of course, bearing in mind the uncertainty as we go into Christmas and what may or may not happen into the new year, I think during this period we're going to have to look again about what are our plans around visitors in the new year, if that's going ahead, and if there are further close downs which are being rumoured in the papers today. No detail behind any of that other than the usual leaks from Westminster in the daily rags. But I have talked to the steamship group this morning, etc., about keeping an eye on passenger numbers if things do begin to have an impact into the new year, about whether we need to go and ask for further subsidy for our transport lifeline links. Hopefully we won't, but I think the earlier we keep making that point, the better about the very nature of the lifeline service to the Scillies. And of course, we will be lobbying alongside the LGA for financial support to our local businesses, particularly if they are impacted by a downturn from people, in effect, making their own personal choices, even if they're not government choices. So for me, it feels like it's now time again, whilst perhaps we all hoped that it had gone away, that it hasn't, that we will be, again, reviewing our plans. I think we probably will be looking at keeping the EVAC scheme going again, but we'll discuss that with members in due course. And I think we just need to, we're going to have to react quite quickly if the rumours are true about any announcements that may or may not be after Christmas. I'm seeing the paper today, they're talking about the 28th, 29th of December possibly being further announcements, but it's all speculation at the moment. So that's all from me, Chairman. You're muted, Chairman. Fran, you're still on mute.
Oh, sorry. My question, if I may just ask you a quick question before opening it to the floor, Paul. How are we thinking of how we would handle a scenario where we had a lockdown and everyone presumably could they finish their holiday, or would they have to immediately leave? I mean, I think we followed this through the last time.
Yeah, I mean, those are the sorts of things, Chairman, that we're going to have a look at again now. If it's the same as last time, I think people, if there is a lockdown, would be expected to travel home. But I'm supposing, surmising about information that's not in my domain yet. So I'd be remiss of me to give you details that I don't actually know myself at the moment, Prem.
No, it's just reassuring to know that it's all in hand. Thank you. Councillor Bedford.
I suppose my concern is, even if symptoms are mild, it's the fact that staff will have to self-isolate for 10 days. And, the staffing levels on the island in really essential services are stretched anyway.
Yeah.
So I just wonder whether we want to have a review of our emergency plans for staffing. It was over four phases last time, but that would be my main concern.
Yeah, no, I agree absolutely, Councillor Bedford. Particularly, I mean, you'll remember last time we split crews, for example, at the like air traffic control at Park House. In terms of operational services, even down to people not being able to use the sort of kitchen at the same time and having to clean it down between. So I think we're going to have to look at all of that again. And you're quite right. Our first priority will be those essential frontline services that we must keep going. At all costs. Because I would imagine as well, I'm expecting, that there will be a further requirement for people to work from home. I think pretty much people are doing that already, but I'm sure it'll probably become even more expected in the January period, but we'll wait and see.
The hospital's already in having challenges, and I just think this will be one challenge they could not probably address if they had more staff going off.
Thank you. Has anyone else a question for Paul before we move on to the Director of Public Health? Councillor Sims.
Yes, good morning all. I don't know, really. We sort of, the situation we're in now is, I think, completely invidious. We have a sort of lockdown by stealth and no tools whatsoever to deal with the people who wish to be reckless, and it's just crazy. I mean, we seem to be okay here, but I'm sure people must be having, it must be an absolute nightmare in Cornwall, because I know lots of people will be travelling to Cornwall and stuff, because some people just, I don't know, it's this, you're allowed to have a party but don't go to it, and it's just crazy. So I'm extremely worried, that's what I'm saying, really. Can we ask people to make sure they test before they come over? Or we can't tell them to, but we can ask them to, at least, stuff like that.
Yeah, I mean, I think we have to, as ever, Councillor Sims, my line and my advice to members all the way through is that we always stick under the advice of public health and we follow national guidance. I think to deviate from that is always dangerous. But we are, and I know Tommy will talk about it later, we did refresh the comms, last week. We are continuing to try and be, as carefully as we can on the travel routes to and from the air, to the islands, probably more than other places. So it's not that we're not pushing those messages, but you're right. I think the tools that go with them, we'll have to wait and see whether they're announced or not. But obviously Parliament's got its own issues at the moment, as shown by the vote last week.
Indeed. Have I missed anybody? Any other questions before we ask our Director of Public Health to address us? No. In that case, an update from the Director of Public Health will follow. Thank you.
Thank you, Chair. So I thought I'd just give you a sort of general situation in Cornwall and the Isles of Scilly in terms of our case rates and situation and the variants. A little bit of news about what we know about it and why obviously there's concerns about the next month ahead. And then to sort of reiterate some of those public health messages that we all want to share with our residents. So in terms of our case numbers, obviously we've maintained in Cornwall in particular, we have had a consistently sort of high rate of cases since the end of the summer, and we also have neighbouring authorities now, particularly Plymouth, that have some of the highest rates in the country. So whilst in the past, I think particularly mainland and Cornwall, we've been fared relatively well in terms of being a lower sort of less affected, we're certainly not considering ourselves in that position anymore. So current rates are 485 per 100,000 in Cornwall, and last cases in Isles of Scilly now back in November to date. So whilst that's a good situation for cities, obviously there's that interaction and needs to be seen in the context of where people travel to and from, etc. But particularly, as I say, Plymouth with a rate of just sort of around up and down to around 800 per 100,000 in a 7-day period. So you'll see that obviously proximity can have an effect as well as that travel, as we know from the past. And the age rates that seem to be affected, and this is across all types of cases of COVID, is now sort of getting higher within the 16 to 29 age group. Previously more in the sort of school age or the 0 to sort of 15 age group, but it's now moving across into more that age of people but obviously with the schools closing, we're no doubt see that change over the coming weeks. But it is still higher rates in the younger age groups, which is of course what we want to see, and not obviously infecting people of older age, which are a higher risk. In Cornwall itself, there's particular areas with higher rates in the north, and then in the adjacent to Plymouth, which wouldn't be a surprise. But all areas showing sort of much higher rates than we've had previously. What we currently aren't seeing at the moment is at this stage, because our case rates are usually 5 days behind the day we are in now, is that we haven't as yet seen that dramatic increase. But from what we see from other parts of the country, and certainly knowing the rapid increase through the Omicron variant, that could double every 2 days, I think it's fair to say it's only a matter of time in most of the country that there will be a steep increase, even if you're not seeing it now. We have got confirmed Omicron cases within Cornwall. That's been the case for some weeks now. We don't get all of them fully typed to find out whether they are. We just know we have a large proportion, and we're not really acting any differently in respect of that. So it's not so much counting the cases, it's what the impact is on our system, on our staffing, as we go through Christmas and into the new year. So we have Omicron. I think that's not a debate, and it's likely to be sort of the dominant variant from at least the next couple of days' time, slightly later than the rest of the country. What we do know about Omicron is not particularly good, and there are some things we don't know. But we do know that it seems to move between people faster, so there's a higher reproductive rate, the R number, which we talked before, and there does seem to be, a much quicker increase in cases. Doubling in 2 days is not something we saw even in the first wave early on. I think the key thing to be cautious around, and this is what we know, is that the first and second doses of the vaccine aren't as effective as the...
Rachel, you're frozen. I don't know if you can hear me.
Sorry, I'm back. I think I just dropped out there. Apologies. So hopefully you can hear me. So I was just saying the first and second dose not as effective at protecting against symptoms of COVID, or also we think potentially then hospitalisations, but the booster is still effective. So very important, obviously sharing with the public, and I think coming through loud and clear from Chief Medical Officer, Prime Minister, that the booster is key in protecting people, that the first and second dose not as effective, and also that people can be more infected as compared with the vaccination of the first and second, and also that you can become reinfected by Omicron. So they're the things that we do know about it, and clearly there's people who may have had a COVID infection and think, well, that's me. I'm protected because I now have this immunity from being infected with COVID, and that's not the case. You can get reinfected, and that's still a relatively small proportion, but an important element of understanding what happens next. So clearly we're looking out to understand what the impact is on people needing to have NHS care and hospital support if they are infected, and that's the key. We're looking to London, and there has been a 30 to 40% increase in hospital admissions with people with COVID in that area, which is a higher rate. So obviously some concerning pictures, which is why you're hearing the medical advice to say be cautious. And I think the messages that I wanted to really reiterate to all residents is around making sensible choices. Whilst we've got the Plan B restrictions, which do encourage us to wear face coverings and then limit some of the access to some big events. There's more emphasis on personal responsibility. We do have tools in the box like the rapid lateral flow tests, which are available on the cities, So we encourage people when they're going out or meeting other people that they do test. If people have symptoms, to do a PCR test on the Isles of Scilly. That is available through the national ordering system now to arrive to homes. So that's two sort of very clear things around testing being important, so then you can stay at home. And also, if you're out, please be cautious, wash your hands, and if you're socialising indoors with friends, then you can still ventilate. We know those things all make a difference, as well as getting your booster. So really, I think very clear that we continue to be sensible and also to use the same methods as we had with Delta. It's not something different we need to do. We need to do the same things, but more of them. And I hope that's useful messaging for residents of the Isles of Scilly. Thank you.
Thank you very much. Questions now? Councillor Legg.
Thank you. You mentioned Omicron and sort of the known unknowns. With hospitalisations from it, I've heard so many rumours in the press about, there's not as many hospitalisations and, we won't know yet. And I believe it's the case that you wouldn't actually expect to see a rise in hospitalisations from it until after Christmas. So any news on that yet is complete made up. Is that correct?
So yes, I mean, usually there's a 2 to 3 week delay in the numbers of cases and infections rising to what we do see then as people may need hospital care. But we are basing this on very early findings and in some cases what was seen in South Africa based on really small numbers. But there are the scientific advisory group, the SAGE group, have published sort of early non-peer-reviewed sort of papers which do give some indication that there's certainly a reduction in the protection of the vaccine. So anything that has that clearly means that there will be people who could be affected more seriously than when we were with the Delta variant in the previous few months. So very difficult to give the confidence, as you've heard, but we'll be looking to other areas as we see that they are ahead in terms of both the numbers of cases and the proportion of Omicron variants. So we will be further down the line, thankfully, but expect cases to rise certainly after Christmas. What we saw last year, people seek testing on the mainland after Christmas is a trend, and then get identified, and potentially 2 to 3 weeks later we may see that increase then in hospital admissions.
I think the idea that it's not as severe because there's less hospitalisations is it's a really dangerous rumour, because people just become lax about the measures to take. So I think it's really key to get the information out there, but we don't know yet, and you do need to take this seriously.
Absolutely. And I think, as Councillor Bedford has raised, there's also an issue around maintaining our critical services. As we know, that's key. So whilst we're concerned about the hospital activity, there's also our other primary services that rely on workforce to get, support people and to deliver key services. And the more infections, the more that is at risk.
I would also just add, if I may, that we don't really know the long-term effects of this Omicron virus. It would appear that it doesn't affect people in the first instance quite as badly, although obviously there's a knock-on effect, as colleagues have mentioned. But we don't know whether or not this virus might induce a long COVID to a greater degree than the Delta variant. We've got so much that we don't know. It's obviously very wise to be cautious. Councillor Williams, you have your hand up.
I do, but I think Harry sort of probably picked up on the question. I was going to sort of ask about hospital admissions as well, and I'm guessing that the hospitals in the southwest are probably pretty busy as they are with all the other things going on with winter. So I was just wondering how much capacity, how much more until they sort of hit a critical level, or a very, very critical level. Are we able to get a gauge on that?
I mean, I'm not speaking on behalf of the NHS, but I know that the whole NHS are on level 4 alert and declared a major incident across the country and certainly in the region on the situation in hospitals and for the NHS. So I think it's very clear that they're already at the point where this is anything that is above and beyond what's currently going on is very difficult to manage at the season where people have leave, there are increasing infections, and there's lots of winter illnesses that aren't COVID and other critical issues. So I think, it's really important, as the message has been throughout the pandemic, that we do try and protect the NHS, but people still need to come forward for healthcare that they need and use the services that are there for anything that is an emergency or urgent.
Thank you. Is it worth asking you to reiterate the fact that people can still have their first and second jabs if they realise now that they would like to be protected, as well as their boosters, and also that the flu vaccine is also very important and pivotal at the moment?
Absolutely. Thank you, Councillor Gossick. And absolutely. If people haven't had their first or second, it's still absolutely fine to come forward to have those and to start that dose. There may be people who have been prompted by the change in direction that mean that they do that. You'll be welcomed. No one's judging anybody. So please do come forward. We've had across Cornwall, Yards and Scilly, I think we've got now 86% have had the first dose, 80% second dose, and 55% or just over that now with a booster or third dose having had that as well. So we are doing very well. People are coming forward, and we hope that continues to get to the end of December, which is the target date, to have people boosted as much as possible. So we're on the right direction. And absolutely, the GPs are offering the flu vaccination as well. So that also is effective and is something that seasonally every year we'll see flu more towards the early spring of a year. So great time to get protected against that as well. So certainly encourage people to think ahead.
Thank you very much. Any other questions for the Director of Public Health? In that case, if we might move on to the local comms situation with Tom Walton, please.
Thank you, Chairman. Rachel's done a really excellent job, obviously, of summarising the main comms messages from government, and we've been amplifying all those messages through the local channels, and we'll continue to keep track of them because we appreciate there are often the initial announcement comes out, so plan B everyone, but then there's often nuances to that about how long you isolate for or the circumstances under which you isolate, whether it's Omicron, etc. So we're trying to keep on top of those as they come out. And as Paul mentioned, we're keeping our ears to the ground about the announcement potentially over the Christmas period or shortly after Christmas about any further measures. So we'll keep our eye on that over Christmas. We did put out a localised message around PCR testing. I think Rachel mentioned it there. We've moved from a completely local version of PCR testing to the national route, which is essentially you order it online or you order it over the phone. It's posted to you. You do the test and you post it back, which is for a lot of people that'll feel a bit different, but it's still the same PCR test, and we still strongly encourage everyone to get tested if they need to, and obviously if they've got symptoms. It's important to remember as well that local support is still there for those who are struggling to do the tests or they just don't understand part of the testing service. They're encouraged to get in touch. We've not dropped all of our local support or anything like that. It's just we're moving towards that national route in terms of comms and testing. In terms of follow-up comms, it really is just a case of keeping our ear to the ground for any further announcements from government. So I'll leave it there for now, but obviously happy to answer any questions.
Tom, can I ask you a question, please, from the Chair? And that is, I believe if you're going in for planned surgery, that the health service will actually contact you with regard to your PCR test. Am I correct in that?
Yeah, so if that's the case, you'll be contacted and spoken to about PCR testing or whatever test that they want you to get prior to whatever it is you're doing. So if it's surgery or if it's an appointment on the mainland, they might request a particular form of testing based on that. But they will tell you that direct. And it might be that they point you towards the local route or towards the postal route, but they'll engage with you on that topic when they contact you.
Thank you. I just thought it might be a good idea just to clarify that. Chief Exec.
Thank you, Chairman. It was just a message to members and members on this board, really. So, as I said earlier, we expect perhaps some further restrictions to be announced in due course. I have no details at all about what they might be. Anything else would be just making it up. But I do think it's important that we keep communicating, particularly with our business sector, that if restrictions are brought in, then I think, I'm sure that you would want me as the Chief Executive to be lobbying government for ongoing financial support to businesses. So perhaps I could ask everybody just to keep your ear to the ground and communicate with local businesses about what actually is beginning to impact on the ground, and in which case then I've got some evidence to talk to government about lobbying on behalf of the business community for ongoing support if it is required, and that's all subject to whatever announcements might be made. So it's just a heads up about just keeping that communications going. Thank you, Chairman.
Thank you very much. I mean, we've often discussed that we've got COVID and then we've got economic COVID, and obviously the two go hand in hand. Councillor Sims.
Yeah, a question which I suspect nobody would be able to answer. Does anybody have any information about if we have going to have lots of toing and froing over Christmas? I mean, it may be quite minimal, but obviously, if there's a lot of toing and fro over Christmas, that will and probably would constrain people's actions. But I guess there's nobody here would actually be able to answer that.
Chairman, do you mean, Councillor Sims, in terms of people perhaps coming to the islands for a Christmas break that had already booked holidays?
I'm thinking that more than students coming back. I know we can be quite busy here at Christmas with holidays, but I have no idea.
Yeah.
Yeah,
and of course, I mean, as you all know, the government has been quite clear, in effect, to not mandate Christmas being cancelled. As I understand it, and Rachel might put me right if I'm wrong here, it's too late now for Parliament to be recalled to consider further restrictions for Christmas itself. That's what all the supposition is about. So I think, people who were going to come to the islands for Christmas are probably already there, bearing in mind schools broke up the week before, or are arriving, and there's nothing to stop them doing so unless their own personal choice or risk assessment. I think that's right, Rachel, isn't it?
Absolutely, yeah. I mean, there aren't any restrictions. I don't know the detail of what may come ahead, so I think it's difficult to call, even if Parliament isn't sitting. But I think certainly we need to act within what current rules are and just encourage that responsibility. Obviously, all the transport providers are well versed in ensuring that face coverings are used, and that's something that's been very successful over periods where there have been higher rates of cases in communities. So that's been something you've learned from it in terms of that interaction and visitor numbers. As people keep in their own homes, I think it's what they do in that situation if they do come over or that anyone is infected. Very close contact inside in field room where you're spending some hours together is the higher risk, and that's for everybody to take on board really around how they behave with their friends and family.
Thank you. Mr. May.
Thank you, Chairman. Yeah, I mean, if it's of any use at all, and if we're atypical, we haven't got any guests coming to stay for Christmas, but we've got, I think it's 9 out of 12 properties occupied for the new year. So if we are atypical, then there would appear to be a few people coming in for the new year. And equally, Paul, to answer your question, of course, as far as economics are concerned, at this stage, if there is any restrictions put in place, then obviously the economic impact is not insignificant.
Indeed. But as so many colleagues have said, it's really a question of wait and see at the moment, urging everyone to be cautious and follow the prevention message that we've just outlined. Booster jabs are obviously key, and we hope as many people as possible have had them, and the hand-face space, and perhaps just to mention, closing, we've got plenty of fresh air around here, as we all know, often to our cost. So hopefully we'll be opening up the windows and being careful to have plenty of ventilation as well. So I think on that note, unless anyone else has anything to say, I'll just say stay safe, take care, and enjoy Christmas and New Year. Thank you very much for your time this morning.
Thank you.
Could I have a brief chat with Fran and Paul when everybody else goes?
Thank you. Wishing you all well for Christmas and New Year, and stay safe, as Fran says. Bye.
Thank you.